All right, diabetes mellitus. So diabetes mellitus is a metabolic disorder with abnormally long blood sugar levels in the blood, right? Very common condition among Americans, right? Leads to, if not treated, can lead to a lot of biological abnormalities and eventually death, right? And so diabetic mellitus can be characterized as, based off of their signs and symptoms, as several very common signs and symptoms. So we have polydipsia, excessive thirst, polyphagia, which is increased appetite, and polyuria. Polyuria, excessive urination, right? Because there's a abnormal osmolarity that's been created based off of this diabetic mellitus, right? Other conditions like glucosuria, so instances where you have urine and glucose present, right? So you have abnormal amounts of sugar present in your urine, right? Hence the word mellitus. Mellitus means honey. So back in the day, before technology was advanced, the doctors needed to use certain kinds of procedures in order to test for or even confirm the diagnosis of diabetes mellitus. So what do you think they did? Instances of glucosuria, so sugar in the urine. What do you think the doctors did? The doctors actually drank the urine, right, to confirm any kind of diabetes mellitus, right? So they drank pee in order to say this person has diabetic mellitus, right? These are the general signs and symptoms. What else would be some other symptoms that we can use? For example, weight loss, fatigue, change in body pH, so the body becomes more acidic, right? So glucose is not metabolized in the correct fashion, right? So this causes the body to utilize another source, whereas your fats get broken down into ketones, and these ketones have a very acidic nature. So this acidity leads to a phenomenon called ketoacidosis. And because of these ketone smells, ketones are another very common chemical that is a ketone, or acetone. So the patients have this acetone breath, right? And so these are some very common symptoms for diabetes mellitus. So if we look at the types, so there's 3 specific types of diabetes. So the first type, type 1. Type 1 diabetes is an autoimmune disease where the body begins to attack itself, right? So we learned before of what kind of cells secrete insulin, right? So there's these beta cells that secrete insulin from your pancreas, and there's an autoimmunity where the body actually attacks these these beta cells. And so these beta cells are destroyed, so the patient cannot produce any kind of insulin. This is congenital, however, so meaning that the patient can be born with this condition. However, there are some instances where later on in life, you can be exposed to type 1 diabetes as well, right? And so these patients are called insulin dependent. So what does that mean? That means they cannot produce their own insulin, so they need some kind of synthetic insulin to be injected in order to monitor their blood type. So next, so this is type 1. There's next one is type 2. So type 2 is a very common type of condition, right? Affects this is the common diabetes mellitus that most people are aware of. They're insulin independent, meaning that they can produce their own insulin. Okay, so they're independent. However, they are resistant to it. So when the blood sugar goes up, the body either the reaction is very delayed, or there is no secretion of insulin that is created, right? And so these patients all patients with diabetes experience this condition called hyperglycemia, all right? So hyperglycemia means excessive blood sugar levels. So hyperglycemia, so too much glucose in the blood, right? So you have type 1, type 2, and so patients with type 2, so type 1, they need a specific type of supplementation of insulin, right? Because they can't create their own. Type 2, however, what they use is very, very simple way is change in diet and exercise. So lifestyle changes. So the treatment for type 2 diabetes is lifestyle changes, right? And so, for example, if you change your appetite or your food that you take in, or what else, you begin exercising, or you begin to access this blood circulation. A lot of patients that have type 2 diabetes have instances of remission of their diabetes based off of the treatment of just diet and exercise, stress management, stop doing any other kind of bad habits. Don't smoke, right? No alcohol, all right? And then type 3 is called gestational diabetes. So gestational diabetes is very similar to type 2, right? It happens when the woman is pregnant, right? So during gestation, right? My mama had the gestational diabetes, still blames me for it every single day, right? And so these patients experience instances of insulin resistance, right? So when their blood sugar goes up, they have this lack of secretion of insulin from their bodies, which can lead to instances of hyperglycemia, right? So there are instances where these patients can, after birth, can either lose this condition, right? So their diabetes mellitus, their type 2 can actually go into remission, right? Or they develop and now they have type 2 diabetes, right? So depending on birth, some mothers can or cannot have type 2 diabetes, right? So after they have the diagnosis, baby's born, they either have it or they don't. So both scenarios is possible. And that's another way of saying type 3 diabetes.